Welcome everyone. Today we're going to start here in just a minute. It's 12:07, just a few minutes after. We had a little bit of connectivity issues, but we're super grateful to be able to have Dr. Hani Chaabo from the Ridgecrest Regional Hospital with us today. He's going to share some mindfulness techniques and also some de-stressing techniques, which coming out of COVID, I think we all could use some de-stressing moment. I have a new puppy, so maybe I should say I need some de-stressing techniques that I can use. So want to highlight just a few things. Want to say welcome to Jake from McCarthy's office. Grateful that you're here. We're recording this to be able to present this and make this available later. And also want to highlight that next week we have a Leadership Ridgecrest networking and planning meeting on November 15th at John's Pizza. So I'll make that announcement again later at the end. But grateful to have Dr. Hani Chaabo, and he's been at the hospital for a handful of years now, and he shared back in September, August, just briefly. And after that, I just felt like he had a lot more that he could have shared with us, and so asked if he could come back and give a little bit more info. So I'm just going to hand it over here. Dr. Chaabo, we'll have you share as long as you want, and then we could do some Q&A afterwards if time permits and if you're open to that.
Absolutely.
Great.
Thank you so much for having me. It's such a pleasure to be here with you guys again. I really feel like this is a beautiful getting together of a lot of people that care a lot about this community and also have a platform to make changes. And I see some familiar faces here like Bernie and Mary, and so it's really nice to be with you guys. Jake, I love that your camera is turned on. If anyone else has the courage or the openness to turn on their camera today, I would really appreciate that. Thanks, Natalie. It's always nice to see your faces and just feel, hey, Gina. Just feel like I'm talking to people because we are also a small group. So it's nice to feel like we're actually together, right? So yeah, I'm here to talk about mindfulness. And it's actually my favorite thing to talk about really ever. It gives me purpose and it gives me joy in my personal life and also in my job as a doctor. Like today, for example, the day has been super all over the place from the minute I walked in. Until now. So before we even started, I had to sit down and do a 10-minute meditation. I had a sound bowl experience going on in the background. It really helped me center. And when the IT problems were happening, I could feel on one side my anxiety, my, oh no, what's going on? I should have checked this. I should have, could have, would have, etc. All that dialogue. And on one side, I was like, nope. Remember mindfulness, remember to breathe, remember to just stay present. Okay, what are we doing next? 1, 2, 3. And so we kind of got through it. And, that's today, but mindfulness has been a very dominant part of my life for more than a decade now. Is there any way I can share slides or no? Yeah. Okay.
Yeah, you should have 3 dots there at the bottom of all those tabs. So if you click, right next to the 3 dots, there's a square with an arrow. And that should be the present now.
Okay, so let's share my entire screen. And then I just want to share. Okay, share. There we go. So you guys can see my screen now?
Yes.
Yes, so you see a presentation. It says the journey inwards.
Correct.
Okay, cool. So this is basically class 1 from an 8-week program that we give here at the Rural Health Clinic that teaches people about mindfulness. So I brought some slides from this presentation to share some content with you. And so I was telling you that mindfulness has been a very dominant part of my life. This is me about 10 years ago. I was obese, I was riddled with anxiety, I had panic attacks very regularly. I was unhappy in my life and in the way that my career was going. And in many ways, I felt stuck. I felt like, okay, where do I go from here? And that's when I landed on a book called How to Get From Where You Are to Where You Want to Be by Cherry Huber, which for me, every time I've felt stuck, somehow I landed on a book that was helpful. And that book came to my rescue because the title was so ambitious, right? I wanted to get away from where I was at right now. And it turned out to actually be all about meditation and really plugging into the now and finding healing and joy in the now. And so it started with 5 minutes a day. And those 5 minutes were really grueling. Like I would sit there and I would struggle and squirm. And today I can meditate for the longest I've gone is about 2 hours. And it feels blissful. It doesn't feel difficult at all. And I think every single positive change that happened in my life can be attributed to those 5 minutes that I spent doing 10 years ago. And there's a lot of science behind that as well. So there's a lot of science now that shows that just meditating for 5 minutes a day can make you more successful at attaining every single other lifestyle change you'd like to have in your life. And there was a big Harvard study actually that came out about that from primary care. So from our field where we saw patients start to meditate, and then they became more successful at attaining their health goals, and even more of that, their financial goals and their life goals as well. So for me, it's almost become a calling, like a life gift, a purpose to talk to patients about mindfulness. And that's why we do our 8-week program. And I want to pause for a second and ask you guys, what is your experience with mindfulness? Does anyone here have any experience with mindfulness at all? Raise your hand, turn off your mute button, talk. Nobody here has any experience with mindfulness. Debbie, yes, tell me about your experience with mindfulness. I would love to hear it, if you can. You're muted, honey. Okay. So if you can unmute yourself and tell us, that's great. If you're having technical difficulties, that's fine. If it works, just unmute yourself and talk. But one person out of, actually 2 out of 12 people here have experience with mindfulness. And that's pretty common. I would think that after all this time with mindfulness and all the science that's come out and all the ways it's become part of treatments for so many health conditions, that it's become really something very well known. But in fact, it's not well known at all. So I'm going to share my screen again with you and show you a few things that I find really cool. So you can see my screen again, right? Yes. Okay.
Yes.
Okay.
You might not be able to see all of us nodding our heads. Yes, we
Yeah.
are.
Perfect. Okay. So in the last about 10 years or so, the literature on mindfulness has really exploded. We used to have very sparse literature, and then over the last 10 years or so, there's been a huge explosion in the research, and that comes from multiple areas like neuroscience, psychology, quantum physics, behavioral science, medicine, clinical medicine. And really, it comes from all these different specialties, and it's all starting to come together in such a beautiful story of what is mindfulness, how does it work, why does it work? And that's why it's become so popular. So now we're like seeing it all over the place. I love Mindful Magazine. It's a Canadian magazine that has a lot of really beautiful publications related to the science and people that are leading the field in different ways. But let me share with you some of the science just to really tell you about how it works, why it works. And I'm going to go over this really quickly. So if you have questions about any of it, please feel free to ask. Also, I'm more than happy to come back and give you a more in-depth talk about these things, because usually this is a longer than 1 hour talk, but I'm going to fit it into 5 to 10 minutes so we can really practice meditation, because that's more important than anything. Yeah.
When you talk about mindfulness, is it more than, well, can you describe what it is? You talked about just briefly there, you mentioned it. And when there's 10 of us that don't really know, can you talk what it is? Is it meditation, or is it meditation with purpose? Is it just being mindful of what our goals are, or I have some of those questions.
I love that. You see, your question is multi-layered. Is it just I sit down and meditate, or is it also I'm aware of my life and my direction in my life? And both of those. Mindfulness is both of those. Mindfulness is what's called formal mindfulness, is sitting down and meditating. That's what we view as mindfulness usually, and there's many different types of that, and they affect different areas in your brain. They grow different areas in your brain. And then there's the informal mindfulness, which is bringing that into your daily life. And so really the informal mindfulness is about building awareness. So bringing that meditative quality of attention into the way you wash the dishes, into the way you have a difficult conversation with your partner or your colleagues, into the way you plan for your life, or the way you relate to your life today and tomorrow. So there's multi-layers, but if I was to encapsulate it into a very simple one-word sentence, I would say mindfulness is a way of paying attention in your life. It's a way of paying attention in your life. And the way that the MBSR program defines it, the MBSR program is the Mindfulness-Based Stress Reduction Program, which is the most extensively studied mindfulness intervention in healthcare. It's what my program is based on. It defines it as paying complete attention, so you can see that on the screen. Paying complete attention means using all 5 of your senses. What you're hearing, seeing, feeling, tasting, smelling, etc. And then doing that on purpose, so that there's an intentionality with mindfulness. So directing your attention, because our attention is always hijacked, left and right by our lives. And the more intentional we are about our attention, the more we can affect positive change in our lives in a more directed way, in a more conscious way. And then you're bringing your attention to the present moment, because if I take a snapshot of our lives or of our brain activity, at any moment, we're either thinking about something from the past, or we're planning for something in the future. So it's always very difficult for us to come to the present moment. And it's funny, because the neuroscience has proven to us that spontaneous joy arises out of a present mind. And so if you really the way to really think about that is, if you're seeing a sunset and you're sitting there, you're in San Diego, you're seeing that beautiful beach, that beautiful sunset, but all you're thinking about is all the stress you had last week and the stress that's coming up next week, most likely you're not going to be plugged into that sunset. You're not going to be enjoying it. You might as well not even be in front of that sunset. You're not there. But as soon as you start to look at the colors of the sunset, the yellows and oranges and reds, if you start to look at the colors of the ocean, the greens and blues, the reflection of the sunset, the way the sky is, and then you start to plug into the rest of your senses, you might feel that a breeze on your face. You might feel the wind of the ocean around you. You might hear some children playing around you. You might hear the waves, ebbing and flowing. And as soon as you start to plug into those, maybe even us just talking about those, something calm happens in the body. Spontaneous joy arises. You're plugged into the joy of that moment of watching the sunset. So your problems didn't disappear. The stress that happened last week is still the same. The stress that's going to happen next week is probably still going to happen. But something about plugging into that present moment is calming to the body and the brain. And the last component of mindfulness, which is probably the most important one, and it's the most difficult one, and it's the one that gets us most in meditation, it's what basically makes us quit meditating, is being non-judgmental. Because we move through our lives, we're judging, what we're feeling. I like this, I don't like that, I want this, I don't want that. And then we're judging the judging. So why don't I like this? Why don't I want that? I should want this, I should want that, shoulda, coulda, woulda. And so we're always stuck in that, loop of judgment. And in meditation, the way that arises is, oh, my brain is all over the place, which, by the way, the monkey mind is a common experience to all of us. All of us have a monkey mind. I've been meditating for 10 years. My mind is still a monkey, because that's what it does. But when you are judging yourself in meditation, that sends a distress signal through your body, and that's uncomfortable. And so you come out of meditation. And so learning to identify that judgment and then disidentify from it. So coming back to the present moment, coming back to the breath, coming back to anything that you're focusing on, which is different mindfulness practices. That action of noticing and then coming back, noticing and then coming back, something about that also happens in your daily life. So when you are going through a very stressful moment and your mind's judging and now you're getting stuck in that distress signal of the moment, the better you get at identifying and disidentifying and your mindfulness practice, the better you get at noticing that dialogue and that feeling during a stressful moment. And the better you get at disidentifying and then coming in with all the practices to calm yourself. So I'll give you an example. Like today, I had a very, very rough morning. We were all over the place. I literally finished seeing patients 45 minutes later than I like to see patients. So I was wondering if I'm even going to be able to make it in the beginning of this meeting. And so I noticed myself starting to have all these panicky feelings and judge myself. I should have planned better. What are they going to think of me? They're never going to want to have me back, et cetera, et cetera. And so I noticed that judgment. And it's funny because in that very moment, I had a patient who was having a panic attack because they just got the COVID vaccine. And I had to go in with my own anxiety to calm this person. And so what we did together is we just breathed. All we did is we breathed together. We're going to do some breathing today. And something about that was calming to both of us. And we connected with each other. And at the end of that encounter, we went from being both, panicky, bringing that into our meeting, and then at the end of that meeting, leaving feeling grateful for our meeting, grateful for the events that unfolded for us to come together. And that's also what mindfulness is about. So I know that's a very, very long answer, but does that give you a good definition, explanation, and application of what mindfulness is? Any questions about that or thoughts?
I think that was very helpful. Thank you.
Okay. So, that's a quick overview of what mindfulness is. Let me see, what can I show you more from this? So let me go over a little bit of the science just to really take that point home. There's a site called the American Mindfulness Research Association, which is a wonderful site about all the science behind mindfulness. And so I have it open here. There's all kinds of articles about that. And then over here, you can do a membership, and then there's all kinds of resources related to all the high quality studies that you can look at. So reviews and meta-analyses are usually very high quality studies. So if you're into the science, you can go in there and read about all these studies and see what it works on. But if I was going to summarize it, these are some of the places that it works. So it enhances attention and focus, which makes you more successful at starting and completing tasks, and also managing stress, which can be overwhelming. It enhances well-being on all subjective measures of well-being that we have in clinical medicine. It improves connectedness because it makes you feel like you have more agency in your life. And that makes you feel like you're able to connect more with the people around you. And mainly that's because it works on compassion. So mindfulness helps you rewire into your higher brain, the newer brain, which is very unique to humans in many ways. And a big area is called the compassion center, which the more you train yourself to be in your compassionate brain, the more there is a perception of life that's calmer and more connected and more meaningful, whether that's towards yourself or towards people around you. It enhances cognitive outcomes like memory, test taking, etc. So people that meditate or do mindfulness in their life actually do better when they take tests and have better memory at an older age. And all kinds of other cognitive outcomes. And then emotional regulation is probably the biggest one it works on. So allowing ourselves to notice when feelings are becoming overwhelming and coming in with tools that help us feel like we have agency in those moments. So instead of me being a victim of my own life or being taken by my own life, I can look at my own life from a platform. That's in the brain, that's what it does. It allows you to hook onto the areas in the brain that allows you to look at your life objectively and decide, okay, this is how I want to respond to this moment. So in many moments, in many ways, it's actually putting a space between trigger and response. And that's what allows emotional regulation. It allows an intentionality, a choice in how I want to respond when feelings are getting overwhelming. And that makes life a little bit more meaningful. And then when it comes to the clinical outcomes, it can be as effective as blood pressure medication in reducing blood pressure, hypertension. And so, in terms of cardiovascular health, reducing blood pressure is one of the most effective ways of reducing your chances of stroke or heart attack. So lots of studies there. In terms of chronic pain, it's part of the national guidelines for treating chronic pain, whether that's headaches or migraines or chronic back pain. It can be more effective than opioid pain medications. So in lots of studies, we've seen that people can modulate their pain intensity by as high as 60%, whereas with opioid pain medications, you're lucky if you get about 15 to 30%. So it can be twice as effective as pain medications. When it comes to the immune system, it can regulate the immune system when it's overactive, and it can also enhance the immune system when it's underactive. So, for example, autoimmune disorders like psoriasis, where they manifest as a skin condition, it can be very painful, very debilitating. Patients that underwent light therapy, which is a treatment for psoriasis, who did meditation before they underwent the light therapy, healed 4 times faster than people who did the light therapy without meditation. So we could even photograph the healing effects of mindfulness in that way. And there's studies on all kinds of autoimmune disorders, not just psoriasis. And then people who got a flu shot and meditated before they got a flu shot, they mounted a more robust antibody response than people who didn't meditate. So those are examples of how it can regulate and enhance the immune system. When it comes to mental health, it can be curative of insomnia, anxiety, depression. It actually has effects on almost every mental health disorder except schizophrenia, it seems, which that's still being studied as well. And certainly in my field, that's why I use it, because I see patients all the time with mental health issues. It's actually 2/3 of my practice is mental health disorders or stress related. And that's a fact that's been proven by the American Academy of Family Physicians. So it's really empowering to have a tool that can help in that way. And when it comes to aging, people in their 50s that have been meditating since their 30s have brains of 30-year-olds on MRI scanners. And also, from molecular and cellular biology, we can see the activity of an enzyme that shortens the DNA with age gets slower when you meditate. So the DNA is preserved for longer, which has longevity effects. And then quality of life, mainly with people that are caring for other people that have disabilities, like caregivers of partners with dementia or children with autism. Those caregivers, when they started to practice mindfulness, felt like they were better able to give care to those people and to feel more like their life is meaningful because they're giving that care, and not feel overwhelmed by giving that care. So really, it's all around, it's rejuvenating, it's helpful, and it's proven by more than 50 years of science now. Any questions about that or thoughts?
Yeah, Dr. Chaabo,
Yeah.
Debbie Benson, who raised her hand earlier,
Yes.
typed in a question. She wrote, "Do you find that mindfulness becomes a part of activity rather than silence and removal from activity? I find this is a pathway to integrate it into my day."
Mm-hmm. I love that. Thank you for asking that question, because that's absolutely it. The mindfulness that you're integrating into your day is bringing that quality of attention that you practice in meditation, that you strengthen in meditation. That's the playing field. You strengthen it in meditation, and then you bring it out into your daily life by bringing that quality of attention with you. So, for example, if I'm arguing with someone, and I'm starting to feel like my nervous system is getting hyperactivated, I'm getting tight, I'm getting racy in my head, I'm getting hateful in my feelings, and I'm starting to notice all of that. And then because of my mindfulness practice, I'm able to say, okay, hold on a second. I don't want to respond this way to this person. So let me relax my body. So that's me building awareness into my body, which I've started building in my mindfulness practice when I'm meditating. Let me switch my thought processes out a little bit. Usually what I do when I'm feeling hateful is I imagine myself hugging that person. So, somebody could be calling me an expletive in the clinic, and the next thing I'm doing in my head is hugging that patient. Even if I don't want to hug them in real life, in my head, I'm hugging them to go into my compassionate brain. And then I'm responding to that moment. Then I'm coming in with whatever I want to come in that moment. And that's been life-saving to me in moments where I had tense patient encounters. It's also been life-saving for me in my marriage. And so I don't know if that answers your question. Does it? You can put it in the chat. I know your microphone. It does. Okay, wonderful. Any other questions or thoughts about that? Okay.
I had a question.
Yes.
And then I think Rebecca might have a question. Is mindfulness connected to a specific faith tradition?
Oh, great question. Thank you so much for asking that. Oh my gosh. Okay. That's something I get a lot. I can't meditate because I'm a Christian, right? I get that so much in the clinic. And here's the thing, mindfulness started in the Buddhist tradition, like formally as mindfulness. But if you really look at every single religion has a mindfulness practice, whether it's Christianity, Islam, Hinduism, every single religion has a mindfulness practice. So mindfulness is part of religion. Now, the cherry on top is that with the MBSR program, we've stripped mindfulness of any God talk, any religion. It's not connected to religion at all, because now, thanks to religion, I guess, we're able to take a practice that we know is helpful in a physical and mental way without needing to connect it to a religion. And if you bring that quality of attention into your religious practice, that's amazing. Good for you. Double whammy there. So in a way, it is and it isn't, and you make it your own. And that's the beauty of mindfulness practice. Each one of us here will have their own practice because we're going to use it in our own ways. And in my group program, so our group program is 8 weeks long. People come in and leave. They're completely different people. And I've been teaching mindfulness now for 6 years. And I will tell you, I'm not the teacher. People take these tools, they use them in their own lives and their own events. People have lost spouses during the 8 weeks we've been together. They've gotten really depressed during the 8 weeks we've been together. And the way that they've navigated all that using these tools has been probably the most meaningful thing for me in my life. And so, yes, it's religious and it's not religious, and that depends on you. Thank you for asking that.
Thank you.
Rebecca.
Yeah, did you have a question?
So I was just going to ask why maybe this isn't more widespread in medical use, and what your experiences or your hesitancy or resistance that you've met with practicing this way.
Those are great questions. It's actually my pet peeve that this is not as prevalent in medicine, and I feel responsible for making this more widespread. But the answer in a nutshell is not enough people are exposed, so we don't have enough people that know how important it is, because I think word of mouth, and the more people practice this and ask for this, the more we'll have teachers that will provide this in the medical field. And to insurance, for me now, I found a formula that makes it insurance reimbursable, but it's usually not insurance reimbursable. And people that teach mindfulness that are not doctors cannot bill insurance for teaching. So for me, I'm lucky that I'm in a position where I can bill a group visit and talk about anything I want in that group visit. And I chose to talk about mindfulness for 8 weeks. So I created this program, and it's definitely a wave we're seeing. So if you look at all the Ivy League institutions like University of Massachusetts or Harvard, Stanford, etc., all of those now have centers for mindfulness or some kind of mindfulness offering. So we're starting to see it, in the more major institutions. And we're going to follow suit in the smaller institutions. So that was kind of your first question about why it's not a prevalent. And what was your second question again? Remind me, please.
I was just curious if you meet a lot of resistance, either from patients or just other practitioners.
In rural health, no, thank God. It's been a blessing to be here because of how open people are, and I get referrals from doctors all the time for people to come into our program. The resistance that I feel mostly is related to change in general. You know, people resist change in general sometimes. So whether that's, you know, take this medicine or try this app, you know, it's people resist change in general. And I'm trained in a lifestyle change, so motivational interviewing and different tools that help people overcome that resistance. So for me, it's always a welcome challenge if you have resistance. And for me, it's part of the process of working with that resistance, because the more we can identify and understand the resistance, the more we can understand how to reach success as well. So it's kind of like a pebble along the way. But I will tell you, in the US in general, yes. So I recently graduated from an integrative medicine fellowship, which is the marriage of Eastern and Western medicine. And really treating patients in a holistic way. You know, you're not just a set of diseases. You're, you're a set of beliefs and lifestyle experiences, and you're so much more than some diagnoses that are listed in your chart. So how do we work with who you are to make your diagnoses better? And you know, that sounds wonderful, right? Right? Like integrative medicine sounds wonderful, but integrative medicine in general, there's so much resistance to it. Like I've definitely had colleagues in places like Kaiser Permanente or, you know, bigger institutions receive a lot of pushback trying to practice integrative medicine and mindfulness, particularly trying to teach mindfulness. So it's still kind of, you know, push and pull. But what's helping right now is that it's really starting to appear in the national guidelines for treatment of so many conditions. So, you know, now it's kind of like, if you're resisting, then you're really like not part of the solution anymore, you know? So hopefully, I think within the next 10 years, we're going to see this explode. I really do. Any other questions, thoughts? Okay, cool. So before we move into an actual practice, I want to tell you a little bit about how mindfulness has its effects on the body. It works twofold. The first is through neuroplasticity. We used to think that the brain is static. We're born with a certain set of neurons and it never changes. And if you have a stroke, for example, God forbid, that those neurons are dead, they're gone, and you're never going to get that activity ever again. Well, now, thanks to neuroscience, we're understanding that actually the brain has a very plastic component. So it's adapting and it's changing its architecture based on our experiences. And so the way to encapsulate that is what you focus on expands in the brain. And the more you repeat something, the more it becomes a behavior in the brain. And so let's say that you're focusing on, you know, anxiety, negativity, all the bad things that are happening in your life, then the areas that are related to emotional reactivity and negative processing start to expand. And those are your survival-based behaviors in the lower brain. And the areas that are involved with the emotional regulation and positive processing start to shrink. And those are the areas in your higher brain that are more to do with maturity and emotional regulation. So conversely, when you start to practice mindfulness and you start to shift that brain activity, the opposite happens. Emotional regulation, positive processing starts to expand, more connections in the higher brain that allows us to move through life with a little bit more agency, a little bit more meaning and purpose, and less connectivity in the survival-based brain, which is the lower brain. And so that's basically what this slide is showing you. The amygdala, which is your fear center, this part of the brain starts to become less easily activated. Yes?
Sorry to interrupt, but you didn't share your screen.
Oh, I'm sorry about that. Thank you so much. Are we good?
Yeah, thank you.
Perfect. Okay, and thank you for that. So the hippocampus, which is the area related to memory and also regulating this place, the fear center, that part of the brain starts to expand, more gray matter. And notice this is related to learning and memory, so test taking, remembering, etc., and also regulating fear. And then the prefrontal cortex, which is probably the most advanced in humans. It's actually the most advanced in humans and dolphins. Our next, like most related species are chimpanzees and gibbons. And so in our brain, the part of the prefrontal cortex that's associated with us being human, that's called the neocortex, the front part, that makes up about 40% of our brain. Whereas in the species that's next related to us, chimpanzees and gibbons, it makes up about 20% of their brain, so almost half of that. And then in dogs, for example, it's about 10%, in cats, it's about 3%. So this area is really what makes us human, what makes us be able to think about thinking, which is called metacognition, which is essentially mindfulness. And so this part of the brain, which is associated with maturity, regulating emotions, behaviors, making wise decisions, this part of the brain is actually the part that experiences the most density growth when you practice mindfulness. And we start to see the connections of this part of the brain strengthen towards every single other area in the brain. And so that tells you that the more mindfulness you practice, the more your higher brain has a role in the choices and the experiences you're making. Is that clear? Does that make sense? Any questions about that? Okay, cool. And so that's at the level of your brain. At the level of the genes, there is also activity there. So there is a field called epigenetics, which has really shown us that the DNA is turned on or off based on our experiences. And we used to think that 90% of DNA was called introns, which is junk DNA, and only 10% was called exons, which is express DNA. And we used to think that that's it, that's the DNA. But now we understand that actually what we thought was junk DNA, which is turned off, is actually pieces that are turned on or off based on our experiences. And the 10% that's always turned on, those are housekeeping genes that need to be always on so that we can breathe and, you know, go to the restroom and eat and move, etc. And so the way to really visualize that is, you know, identical twins that have the same exact DNA. If one of them develops cancer, the other one has only about a 50% chance of developing cancer. And that's because of the way they lived their life, how they managed their stress, what they ate, how they, you know, if they exercised or not, how they slept, and then how they, what kind of environmental exposures they had in their life. Is that clear as well, or not? Kind of? Okay, so really to drive that point home, your genes are turned on or off based on your experiences. We know that now. And mindfulness helps us turn on the genes that improve longevity, regulate our nervous system, and turn off genes that increase inflammation and cancer, basically. Is that clearer? Okay, awesome. Any questions about that or thoughts? Okay, wonderful. So that's kind of my spiel about mindfulness. I'm going to show you a very quick video just to really like encapsulate what mindfulness is. And then we're going to do a quick practice, okay? Do we have time for all of that, Tim, or should we just move into the practice? Are we talking till 1 or should I end before 1? Yeah, okay, cool. So we'll definitely end at 1. So check out this video. And please feel free to unmute yourself because I'm going to ask you a few questions about this video, but let's just take a look at it for just a moment. So question for, oh, were you going to say something? Hello, Tim, were you going to say something? Or someone else? Okay, I guess not. So question for you guys. Do you think this guy is paying complete attention? Yes or no?
Yes.
Yes.
Absolutely.
Yes.
Do you think he's using all his senses to pay complete attention? Like, is he using his eyes completely, or is he looking somewhere else while he's doing this?
Absolutely.
He's focused.
Look.
He's only looking there, right? He can't look anywhere else but there. What about sound? Is he using sound to create this diagram?
Maybe.
I think so. You know, that sound of that's kind of guiding him, how fast he should go. Okay, do you think he's using his attention in a purposeful way? He's directing his attention, or do you think his attention is everywhere?
It's direct.
Purposeful.
It's purposeful. Okay. Do you think that he's here in the present moment, or he's thinking about last week or next week?
He's here in the present.
Yes, absolutely. And finally, do you think he's judging himself? Oh no, I'm going to make a mistake. Oh no, people are going to hate me for making a mistake, etc. Do you think that he's sitting there judging himself?
No.
No. Wonderful. So, you know, that's just to show you the beauty of paying complete attention, of using mindfulness. This is in creating art, but, you know, life can become art when we pay attention in this way. So I'm hoping that, you know, with all that in mind, you know, it's sold that you will try mindfulness, but really to encapsulate mindfulness, we have to do a practice. I think the practice of mindfulness is the most effective way of experiencing it. So let's do a quick practice. So if you can have your back flat on your chair, so straight back, and legs on the ground. If you're crossing them, try to uncross them, but if that's what's comfortable for you, that's fine. So feet on the ground, and then close your eyes if you can. If you can't close your eyes, that's totally fine. Just find a soft gaze in front of you and maintain it on that. And so let's start with what's called grounding. So we're going to, actually, you know what? Let's start by taking a deep breath. So deep breath in. And deep breath out. Again, deep breath in. And deep breath out. And one more. Maybe the next inhale is a little bit deeper. And the next exhale is a little bit longer. Perfect. Okay, and now let's start the grounding process. So grounding is just paying attention with all of our senses. So let's start by paying attention to the circle of sound. We're always in the middle of a circle of sound. So let's find the farthest sound. And then let's find the closest sound. Sometimes that's the sound of our own breathing. Wonderful. And notice the mind's going to wander. That's totally fine. Just come back to your attention. So let's move into what you are tasting. Just notice any differences in taste at the back of the mouth, at the front of the mouth. And again, notice, are you thinking about the breakfast you had or lunch coming up, etc.? And just come back to the present moment. And then let's pay attention to any smells. And while we're there, let's notice that subtle difference between the temperature at the tip of the nostrils on the inhale and the exhale. So notice any differences there. Is there a difference in temperature at the inhale? And is there a difference at the exhale? Maybe it's a little bit cooler on the inhale and warmer on the exhale. Just a subtle little thing that we can pay attention to. And then finally, let's scan the body from head to toe like a wave, moving across the body, just noticing any sensations in and on the body without judgment. There might be some pain or tension, that's fine. Just noticing. And notice how as soon as you start paying attention like that, you make some minor adjustments. Like there's almost like that intuition of, oh, let me just move my neck this way, or let me just relax my shoulders. That innate healing that comes in when we pay attention. Wonderful. So that's the grounding process, just paying complete attention using all our senses. And so keep your eyes closed. We're going to do a few rounds of what's called coherence breathing, which is proven to calm down the nervous system. We're going to breathe in for 4 and then out for 4. I'm going to count with you, but if you feel more comfortable going at your own pace, please do that. So let's inhale, 1, 2, 3, 4, and exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4. We're going to slow it down just a little bit. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Let's do 3 more. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4. And last one. Inhale, 2, 3, 4. And exhale, 2, 3, 4. Wonderful. So just breathe easy for a moment. Notice any changes. Maybe plugging into your relaxed nervous system is noticeable for you. Or maybe not. It's okay. No judgments. And let's add one more layer. This is probably my favorite part. It's called progressive muscle relaxation. Very effective for insomnia if you have trouble sleeping. So we're going to breathe the same way, 4 in, 4 out. But this time on the inhale, I'm going to ask you to do an action. And on the exhale, I'm going to ask you to relax that action. So let's start. Inhale, raise your eyebrows really high. Raise, raise, raise. And on the exhale, relax the eyebrows, relax the eyelids, relax the eyes. Wonderful. On your next inhale, smile really wide. Smile, smile, smile. And on the exhale, relax the jaw, relax the tongue, relax the mouth. Beautiful. Again, your mind's going to wander. Just come back to the present moment. Notice and come back. Notice and come back. On your next inhale, raise your shoulders to the ears. Inhale, raise, raise, raise. And on the exhale, relax the shoulders. Let them melt to your sides. On your next inhale, take a deep breath in and hold it for 3 seconds. So inhale, hold, 1, 2, 3, and relax, letting it all go. On your next inhale, imagine there's a ball between your thighs and squeeze it. So inhale and squeeze, squeeze, squeeze. And then exhale and relax, relax, relax. And finally, on your next inhale, squeeze the toes. So inhale, squeeze, squeeze, squeeze the toes. And on the exhale, relax the toes. So just take a moment, check in. Those are the points we hold tension. And when we tense and relax them, we invite relaxation. So let's do that one more time. Inhale, raise the eyebrows really high. Inhale, raise, raise, raise. And exhale, relax the eyelids, relax the eyebrows, relax the eyes. On your next inhale, smile really wide. Inhale, smile, smile, smile. And exhale, relax the jaw, relax the tongue, relax the mouth. On your next inhale, raise the shoulders to the ears. Inhale and raise, raise, raise. And on the exhale, relax the shoulders, relax the neck. Wonderful. On your next inhale, take a deep breath in and hold for 3 seconds. So inhale. Hold, 1, 2, 3, and relax the belly. On your next inhale, squeeze the ball. Inhale and squeeze, squeeze, squeeze. And on the next inhale, exhale, relax, relax, relax. And finally the toes. So inhale, squeeze, squeeze, squeeze. And on the exhale, relax, relax, relax. So before you open your eyes, we still have a few minutes. Just take a minute and enjoy the space you created. You just moved into your higher brain. You moved into your rest and recover nervous system, your relaxed parasympathetic response. And so just enjoy that just for a moment before we all go back into our extremely busy and hectic lives. And maybe take that space with you. Maybe bring it with you to your life. And just for a moment, thank yourself. Thank you for being here, for doing this, for experiencing this, for being who you are, and for wanting to bring this attention to your life and everyone around you. Okay, and when you're ready, open your eyes, come back to the room. Welcome back. If you fell asleep, you did it right. Congratulations. Just a little bit. You did it right. Congratulations. So 2 more minutes. Any questions about that or thoughts you wanted to share?
I don't have a question, Dr. Chaabo, but that was excellent. It changes my frame going forward. I feel like I'm in a whole new mindset. But I have to say, when we did the breathing and you noticed the temperature difference, that blew my mind. I've never noticed that before. And I was like, really?
How did it make you feel when you noticed it?
Grounded, or just here now. Being where my feet are made me really aware of where I am in this space here.
So take it, the next time you're in a stressful moment, remember, just notice the temperature sensation, see what happens in that stressful moment. Thank you for sharing that.
Thank you, sir.
Anyone else?
Just looking forward to your class in February.
Yes, Mary, definitely. We'll be there. I'm looking forward to it too. Thank you for the invite. All right. Thank you so much, guys. It was wonderful being here. I appreciate you all. And, go back to being heroes in your lives. Thank you so much. Thank you.
Thank you, Dr. Chaabo, for making time to share this with us.
My pleasure. Thank you.